Hi everyone, it's Dr. Nurse Tutor here, and I'm back with another topic. The previous topic that we spoke about was, why do you want to be a nurse? What is the reason for wanting to be a nurse? Once you have figured that out, the next thing that you need to think about is, what kind of a nurse do you want to be? There are different types of nurses, and it's very important that you understand and you delve into the different types of nurses that they are so you can see what the best fit is for you. There's an LPN, which is a licensed practical nurse. There's an associate's nurse, and there's also a nursing bachelor's of science, which is a usually in a traditional school, a 4-year nursing degree. Now, when you're thinking about, once you decide what kind of a nurse you want to be, you next need to figure out what kind of an institution you want to go to. When I went into nursing school, it was in 2002. Nursing school has changed drastically since I was in nursing school. We have traditional programs, we have accelerated programs. You really need to think about what kind of a program would be a best fit for you. Now, the traditional programs, when you're getting a bachelor's of science in nursing, is usually a 4-year program. The associate's traditional program is usually a 2-year degree, and the LPN program is usually about 18 months. Now, that's traditional. When you're going into an accelerated program, accelerated became a huge thing when COVID came on the scene, and we needed people to get their nursing degrees fairly quickly so that they could get into practice. That's when it became really popular. It's always been around, but it really struck a nerve when we needed nurses on the scene during COVID. Now, with accelerated programs, I've seen nurses get a BSN in an accelerated program in a matter of 6 quarters. Quarters being 10-week quarters, and nurses are getting degrees in a span of a year and a half, maybe 24 months, maybe. And with the associates, they're getting that in a fraction of the time as well as the LPN program, which may be accelerated, maybe 4 quarters. So it's very important to understand. Accelerated sounds good, but with accelerated, that means all of the content you will still be responsible for in a fraction of the time. You need to look into yourself. What kind of a learner are you, right? Do you need a lot of time to figure out information? Do you need a lot of time to understand things? Do you need a lot of time to process things? Are you somebody who can see something in 2.5 seconds and understand it and go take a test? Those are things you need to understand. I understand that financially, money is a factor, right? Also, if you're a parent and you have a family and you need to get things done fast, I understand all of those things. But don't let finances be the reason why you get into an accelerated program when you are not an accelerated learner. I've seen many students get into these kind of programs and are not successful because they are not accelerated learners. If that is something that you need to do, I don't knock anyone for doing it, but please understand what comes with making those kind of decisions. So when you're deciding what kind of a nurse you want to be, I would advise you to look at the different programs, traditional as well as accelerated, as well as what kind of nurse you want to be. Some people want to be LPNs first and then get an associate's and then get a bachelor's. Some people just want to get a bachelor's. Some people just want to get an associate's and be done with it. I was different because when I got into nursing school, I was 17 years old. I went to the University of Rhode Island, and they had a BSN programs. I immediately jumped into the BSN program, and I became a BSN holder when I graduated as a nurse. But that was just the role that I went to based off of the school, the institution that I went to, and I was 17, so I had all the time in the world to stay in school and live in my parents' house and get a degree. So when you're deciding what kind of a nurse you want to be, think about those factors. How much time do you have? Do you have children? Are you a traditional learner? Are you an accelerated learner? You may need to be in an accelerated program because you have responsibilities, but if you're not an accelerated learner, I would not advise you to do something like that because it may be pretty difficult to be successful. These are just a couple of tips. I'm not telling you what it is that you should do, but just be mindful of those things when you get ready to decide what kind of a program you want to be in.